feels more useful than mine too for us. So now we can make a bit of a.
They got rid of the themes. So we're just like, yeah, but they didn't want them siloed by themes, so now it's just the. It's involved, yeah. Following orders.
They come along to a couple of
Instant.
all during my time, but they got contacted on this before, so they kind of said about me something we were over doing. They're well connected and other
Can people online hear us okay?
Yeah, we can hear you, Jonathan.
All right, thank you. All right, well, maybe make a start then. So welcome everyone to SHW Seminar. So we've got 2 speakers today. So we're trying a bit of a format shift. So, we usually do 3 speakers. Last month, we had 1 drop out last minute, so we ended up with 2, and we actually felt it gave a bit more breadth to the talks, a bit more depth to the talks, and then a bit more depth to the discussion after as well. So we're trying explicitly this month to just have 2 speakers to see if that works again. So yeah, first up is going to be Michal, looking at evaluating the health effects of household energy efficiency measures. Then we're going to have Susan and Hannah talking about the community hub as well. So without further ado, I'll just. Do the right thing. Yeah. Good.
Oh, thanks. Do I need some of the.
Yeah, if you want, or just the keyboard, whatever.
I'll say here, yeah. Hi everyone. Yeah, I'm Michal. Here. I'm just going to talk a little bit about sort of the initial stages of a 3-year fellowship, and I'm just going to kind of talk about where I am and how that's informing the sort of upcoming stage of the fellowship. So. Nope. Oh, there it is, yeah. So the main overall aim of this fellowship, which is very kindly being supported by British Academy and University of Glasgow, is to estimate the health effects of household energy improvements, specifically those that are funded by Warmer Home Scotland and area-based schemes. And I'm going to be looking at 2 groups, which are groups that spend quite a lot of time at home and are also impacted quite a lot by the adverse health effects of living in poor housing. So over 65s and young children, looking at a pretty wide range of health outcomes. Just, I guess, the thing to know about Warmer Home Scotland and area-based schemes is that they are funded by Scottish government and pretty much, for the most part, like it's free to anybody who's living in the home. And so it's either tenants or owner occupiers, but it's targeted at people who are in low-income households or in areas of high fuel poverty and in poor quality housing, which is pretty much predominantly measured by energy performance certificates. So anything below a C is considered below standard. And I'm going to be taking a difference in differences approach. So looking at the around 87,000 people of my population who are living in any of the treated homes, and the information about people who are living in those homes for what kind of measure they got, when they got it, is in the home energy efficiency database, and comparing that to people who are living in homes that have not been upgraded by those programs, and some of the ways that we're going to end up kind of balancing between these 2 groups, or seeing the differences between these 2 groups, is looking at the energy performance certificate records, which has information on energy ratings, but also a bunch of other things like the size of the house, the number of habitable rooms. So you get a whole wide range of information. And as I said, looking at Warmer Home Scotland and area-based schemes, which started in 2015 and are still ongoing, and I'm pretty sure are going to be funded. I mean, yeah, I think they're still going to be funded in the next budget is what I've heard, but yeah. And comparing that to kind of the time before, where the interventions that the governments had on improving houses were much more like low-hanging fruit. So you can kind of think of 2015 onwards as more hard to treat homes, and everything before as like, what's the kind of basic thing that we can, improve. I am, as I said, I'm in the early stages, and the first thing that I did was try to get access to data, which is, if anyone knows who's on it, it's kind of a long process. So I'm still in that stage, and while I'm waiting and kind of going through it, I've been finalizing a systematic review and meta-analysis on energy efficiency measures and health outcomes, and using that to inform a kind of more detailed evaluation protocol. And as I'm going to talk about today, mostly is talk about some very, very preliminary findings from the meta-analysis, and think about how like the kind of limitations from the studies that I've identified are going to inform or can't, elements that has on my actual evaluation plan. As I said, this is still preliminary. I think like the major caveat around this review is that it hasn't been second reviewed. I do have a second reviewer now, and hopefully she's going to start soon. And so, this is still very much early stages, but broadly had a pretty wide criteria in terms of the health outcomes that would be included. Any health outcome, any study that mentioned a health outcome. The sort of main thing that we wanted to have in the review is look at households that received energy efficiency measures versus ones that don't. I think just kind of like an initial scoping of the literature, and there've been a lot of reviews around this topic, is that they didn't always include studies with comparators, and it's really important to see obviously what's happening in homes that aren't getting improved. There's lots of reasons why these programs might have you might see an improvement, but that's nothing to do with these programs. So not just before and after studies. After a search that was updated in October 2025, so pretty recently, there was initial 2,000 hits, and in the end, I whittled it down to 24 studies. Again, not been second reviewed, so this might change. For the most part, it was studies using survey data. So looking at, kind of getting surveys of people who lived in treated homes before the intervention, after the intervention, after they're upgraded, and then also looking at kind of surveys for 2 points for people who didn't get the upgrade, with 4 exceptions. And these studies use difference and differences. They're able to actually look at kind of pre-exposure measures and trends, and have, multiple points, because, obviously health is not just happening like that one time before you're getting your house upgraded. And 3 of them use linked administrative data sets. So there was a lot of, I don't say issues with the studies, but like the kind of the main ones that stood out from having done risk of bias assessment, which I did, or critical appraisal, which I did with Robbins I, and risk of bias 2, was selection bias, confounding, and a lot of heterogeneous outcomes. So the main one was with selection bias. Like this is just kind of, I think, an issue with surveys. So you can take, for example, a study that is targeting people living in a given area, all homes below EPC records from a certain area, and let's say 100,000 people are eligible or have received these interventions but the only information you have are people who have actually responded onto the study. And so you can see that like it's not just that maybe this group of people isn't representative of the wider group, it's more that like the people who are responding to the survey are probably going to be fundamentally different than the people who haven't, and the effect that the intervention is going to have on their health might also be fundamentally different. And it's really difficult to kind of adjust for that statistically when you don't have information on everyone else. And so this was a reoccurring issue with a lot of the studies that we identified. And kind of some of the reasons that they might be fundamentally different from everyone else is that they have a lot of health-seeking behaviors, and these are the sorts of things that would affect their health outcome, as well as their understanding, like awareness of a survey being there, and same like engagement with energy reduction technologies. Susan and I were just talking about like an event that was done here with ChangeWorks, like, the people who sort of come to these events and who know about the sort of offerings that are available, because a lot of people don't necessarily know that they're eligible for them, would be fundamentally different. And the effect that these programs would have on their home, because maybe they're more aware of how to use the technology that's been implemented, might again just be fundamentally different. And so you take that and you compare it to one of the few studies I think did a really, really good job in the data that they had of being able to address this is that they had data from people's, so the health data came from people's insurance, and this was in the Netherlands. Yeah, it was in the Netherlands. Insurance is pretty much required or really, really high take up, and because it's subsidized for everyone. So they had public insurance evidence, and then they also had housing improvement information. This was all on social housing, so it's a little easier done in social housing because they had this really big record. They only had half of the social housing that would have gotten the upgrade, but the half that they had was missing completely at random. So the people who weren't in the data set that they had was, you know, whatever, like it's not whatever, but they weren't fundamentally different. They were gone, but it wasn't so different from the people who were. And also the rates and the timing at which people got the interventions was also completely random. The government just kind of looked at the homes or the buildings and said that the homes are in there. Over 70% of tenants agreed that it was going to get upgraded. And so it doesn't really matter. You have no choice over whether you're going to get upgraded. They were all, yeah, got that. This is pretty rare. This is not something that is, yeah, kind of is common. And you can see in one of the, again, preliminary findings, can't emphasize this enough, of the meta-analysis that when you, most of these mental health, and all of these mental health related quality of life estimates are coming from survey data. And you can see that there is a slight improvement actually for people who receive the treated home, who live in treated homes versus people who don't. But, you know, more than half or yeah, half of the studies are at serious risk of selection bias. And so we just kind of have to take that into account that, you know, maybe these again are just fundamentally different people, and the effect they're having is that the intervention is having is fundamentally different than it is on people otherwise who would have been eligible. I'm hoping to address this in my data, in my evaluation. As I said, it's going to be a linked admin data evaluation, and how we're getting people who have received the intervention and also the controls, kind of pretty importantly, is that it's coming from a fundamental, like the basis of the database is from Pearl, which is a registration of everyone in Scotland and their GP. And so you have their addresses, and then you also have their community health index numbers, so their personal identifiers, which makes them linkable to health outcomes, but also, you know, there you have pretty much 100. I mean, I think you have more than 100% because not everybody gets off the GP register when they die, but like almost a remove. Yeah, uptake there. So you have a really big sort of fundamental. The issue will be around energy performance certificates. So there's 2.5 million homes in Scotland, but there are about 1.9 million unique energy performance records. So that number does keep going up every year. So hopefully, probably by the time I get my data, it'll be higher, but hopefully it won't be much higher because that'll mean it's gone too long. And yeah, you can kind of see that from here, like that is, so yeah, improvement logged in HEED. There's no reason to think that if you got the upgrade that you wouldn't be in the central database, because it is like, it's a government backed program. It's not something that's happening separate from that. Like they're keeping track of the interventions, GP registration. The only kind of question is really around the energy performance records. So one of the other issues is confounding. So, you know, the sort of want to pull out respiratory symptoms and conditions, because you can see here that I had to run two different meta-analyses for this, one for odds ratio and one for standard mean difference. And you can see that it has somewhat gone down, kind of. I mean, yeah, it has for one, but well, for the other sort of freshman null effect. But you can see that more than, again, around half of the studies are at serious risk of bias of confounding. And why that's particularly important for respiratory disease is that it's infectious. And so if you are living in a home with someone, you know, kind of one of the primary issues is around living in a home with someone who also has respiratory infections, respiratory conditions, and it makes it more likely that both you're going to get them and that you are going to be eligible or more likely to kind of make a push to get these measures or to be eligible for these measures. And so how I'm trying to account for that in my evaluation is for all respiratory outcomes and also for genetically linked outcomes. I'm asking for, we'll see if I'll get it, hopefully will, for co-dweller respiratory health records to just be able to account for that. Because yeah, household health being a really important confounder in this relationship. And then finally, heterogeneous outcomes. I mean, I think you can kind of see that actually, I think maybe even more clearly with respiratory symptoms and conditions. So as I mentioned, there's like been a lot of reviews on this. This is certainly not the first one, but this is the first meta-analysis in over a decade. And the last meta-analysis just literally like took all the studies that they found, put it together and got an overall pooled effect. And I realized why they did this once I started trying to do this is because actually categorizing and breaking down kind of which estimates should be included in each meta-analysis is really difficult because you'll often get a survey that's asking a bunch of different questions about respiratory health. And it's, you don't want to, you can include multiple in because that can potentially overstate the, the effect that something is having or make it look like there's sort of less variance and less difference across the measures than there actually is. But like you can see, and I mean, I would, totally take if people don't agree with the measures that I put in, but like kind of combining respiratory conditions, wheezing, nighttime coughing, like these are related. Maybe they're sort of too fundamentally different to actually get included. And so this is part of the preliminary thing that might change. But even for a standardized measure, so physical health related quality of life, pretty much all of these were measured using the SF36 or SF12. It's like a measure for health related quality of life. And there are 8 domains in it, 4 related to mental health, 4 related to physical health. And you can see that the PCS, that's the physical component summary. So you can see that over half got this component summary measure from these 8 domains. But a couple of the studies, so the physical functioning, role physical, these are the ones that just reported the individual domain. You can't actually combine them together. It's like a proprietary algorithm that's owned by SF36. So it's not possible for me with just the kind of post-analysis data to pull it all together and get the component summary. And so I ended up making a judgment, potentially not the wrong one, but potentially the wrong one about which one should get included. And so, there's quite a lot of variability there. You can see from the statistical heterogeneity measure. I think that one solution to this is using something that's a little bit more standardized, like hospitalizations, ICD codes, which is something that I'm going to be using. This doesn't really make that case very that well, actually, because the statistical heterogeneity is higher here than it is in the physical health related quality. But I think that's more to do with how they defined non-respiratory measures. So some were acute, some were anything but respiratory. So it was a little bit different, I think, in their definition. There's also a lot of other variations between these studies. But yeah, I hope that kind of helps when I'm thinking about my evaluation going forward. And that's it. Thank you.
Excellent. Any questions at all?
Yeah, that was great, thank you. I suppose it's just in terms of your big evaluation, you mentioned confounders, and I was just thinking you're looking over a period in which there have been pretty profound changes to population health anyway, in relation to sterility, COVID, cost of living crisis. So you're obviously linking different data sets, but how will you be able to adjust for the different effects of all these other things that have been going on at the same time?
Well, what's really good is that I'm asking for that coverage for young children from 2010 onwards and for older 65s from 2009 onwards. So I will be able to take into account, changes in trends, particularly in how it's affected their health. In those instances by just being able to ask for such a wide coverage. But I've also asked for energy prices to be linked because that has changed, particularly thinking of 2022. But there are going to hopefully I'll be able to cover a lot of the big changes, but not every single one of them will show up in the data. But I've tried to be as comprehensive as I could, looking at both changes that would affect health outcomes, and that's being included, and then also energy and housing.
I
think Michal, that was very great. As far as I understand, this is the kind of panel that's the one that you have at the moment. So you're following people across different years, the same individuals.
It's the same individuals, yeah. So some individuals from,
So do you see that there is some sort of problem into identifying your control group in the sense that Its building criteria is not only like the EPC, it has to do with council tax ban. It also has to do with some other things as well. There are also specific people that they are eligible to get based on income. So without so there's different scales, different type of eligibility criteria. And also, how do you account for people moving home? Because probably some people they do this kind of home improvement just to move out, and they move out and to a different house that does not really need improvement.
So
Yeah.
to answer the first question in terms of the income eligibility, so for that, the best that we have is at the small area level. So I'll have children in low income families at the data zone level, and then SIMD. At like local authority, you can see like there's a data set that I also asked to link in like funding, so you can see so area-based schemes are driven by need in an area. And I mean, it's a little bit difficult because all I have is at the local authority level to kind of see whether there are differences in, like kind of concentration of funding. But yeah, it is definitely a limitation that I don't have household income and that we will just be making estimates based on area level, though we'll also have like number of people in a household, which I hope will give some, and overcrowding. So you'll have like size from EPC and then number of CHI, so number of community health index per address. And so hopefully that'll give some sense of deprivation. It's not going to be income, but you can kind of see from overcrowding. And your second question was about moving.
Yes.
So that is depending on how accurate the GP registration records are. So the address that somebody lives in is going to be based on the address that they've registered at the GP. And the other reason that I'm focusing on this group is that these are people that we hope are more likely to have up-to-date or stable GP registrations. If I was looking at like men in their 30s, I probably would have a harder time of pinning down, first of all, seeing where they live, and also like having them live in a home for a meaningful amount of time to have an effect on their health and any improvements that would have effect on their health. But yeah, it's hard to know now without looking at the data, like how frequent, like I hope we'll be able to see that, like if people are moving a lot, it maybe will send a flag of maybe these are people who will put in a sensitivity analysis, kind of make decisions on that. But the idea is broadly that these are people who have a little bit more stability. And yeah, you can see the duration and also when they moved from the GP addresses.
Can I ask about one of the studies, I think it was Howden Chapman or something like that, the author, seemed to be pulling everything towards the really effective, like standing out quite a bit from the others. Was there something about that study? Did they do something different than the others?
So it's part of like a big set of studies that was done in New Zealand, and it was a randomized controlled trial. So that might have been part of it, is that it's just the effect on people's health is just much better and it's there. It might also be the quality of houses or so not good, and that the improvements were really needed. It's hard to know how that one stood out, but it's a really they have a big group in New Zealand that looks at this a lot, and they seem to be like leaders in this area. Yeah.
Anyone online? Wait, ask one more then, if sorry, just an interest. So the difference you're planning, are you going for a single point in time? Is that the idea, like when the policy came in, or or are you kind of staggering the introduction?
The hope is to be able to do staggered and potentially continuous. So to be able to say, so taking it at each year and finding the comparators for kind of each year, and then also to be able to say like for every 6 months of living there, this is like the improvement of health. There's been like so the study that I mentioned in the Netherlands did that. And I mean, they did both. They did both, like this was at a single time point, and then they also did the staggered effect, and they actually found that there was no difference. So I thought that my initial instinct would have been there would be a huge difference, and like it does make, the technology changes, like all of that sort of stuff. But I think I'll try to do both, and then also try to have a level of duration that's in there. If not, at least like kind of stratify the outcomes by duration, because again, I would have thought that makes a difference, and I would have thought that the time that the longer that you live in an improved home would make a difference, but we'll see.
Right.
hopefully I'll be able to do that. It really does depend on the accuracy of
Yeah.
the GP registration. I'm banking quite a lot on that.
Yeah, fingers crossed.
Yeah.
Yeah,
I want to do.
yeah. We've got a couple minutes.
It's quite, the benefit reports are saying that STEM schemes are operated by companies that they were doing like very bad job.
Yeah.
I guess that there's no way of identifying using that data one to one, but is there any way of finding some sort of data where companies were likely to operate or take into account this type of thing? Because it has been like the reports were saying something like crazy numbers, like 85%, 90%. The job they were performed, it was like a lousy job. And actually it became the house became like worse compared to how it was.
Yeah. There was a lot for like insulation. I think people did a pretty shoddy job of insulation. Like, I don't know if it was in 2015, but like early on insulation. And I think also people maybe weren't aware that like you need to ventilate your home. Like you can't just insulate to no end. It's a good question. I haven't thought of that. I wonder if like there is a database of like lawsuits or something or like complaints, and I can just kind of see if there's clusters in areas. Yeah, Peter.
Yeah, and how important that is will depend on what kind of question you're trying to ask. Your kind of intention to treat analysis of the policy, whether you're interested in the efficacy of design, intervention. Which of those questions do you have in mind?
Yeah, it's definitely, yeah, you're right. It's definitely more the former, around that. And yeah, if that is kind of part of the policy and that is part of, if shoddy interventions is part of the policy, then that's gonna come, get picked up, but yeah.
Like a different effect from New Zealand then in that respect.
Yeah.
Right. Thank you very much, Michal. That was excellent. Cheers. Right, next up we've got Susan and Hannes. Oh well, yeah, no worries at all. If you want to use it, feel free to use the keyboard.
Hopefully I'm standing in the right position for people in the online audience.
Looks good. I can see
Thank
it.
So for those of you who I haven't met, although I do recognise lots of familiar names online, thank you so much for joining. But I'm Susan Grant, I'm the Community Engagement Lead for the School of Health and Wellbeing and Byres Community Hub.
I'm Hannah Scobie. I'm a researcher in general practice and primary care, doing a bit of evaluation with Susan.
So first of all, thank you for the opportunity to come and share with colleagues an update, if you like, on the work of Byres Hub. However, I am conscious that there may be some of you who are new to the school or new to the work of the Hub, so just going to start with a very brief overview of what the Hub is. And also for those of you in the room, to introduce Callum, who's in the Hub team, he's waving over there, and I'm sure most of you know Sarah McDonald as well, the academic lead for the Hub. So any hard questions at the end, then we have people in the room who can help me too. So the Hub is a welcoming, accessible civic space right here in the school. Whenever I speak to PGR students or master students at induction and things, I always say, like, you should be really proud that the school that you're studying in is invested so much in this way of working. It's totally different to what other unis are doing, some of this and bits of this, but to actually put your core budget, your resource, your commitment behind this piece of work almost before the research, like the community engagement piece of work, I just think is huge. And it's one of the reasons why I applied to come and work here in the first place. The Hub is, the school is doing that because the Hub is supporting its mission to tackle health inequalities. It's a place where research meets community. I saw a thing on LinkedIn or something last week, and it was talking about third spaces. It was talking about it in reference to libraries, but it was like you've got your home, you've got your work, and then these other spaces where it's almost like blank canvases where things can happen, that libraries often are. And it really resonated with me as this space in the Hub too. Just so much potential with them. Our core day-to-day business, if you like, with the Hub is providing meeting and event spaces for not-for-profit organisations. and then supporting the connections that happen between these organisations, and then of course with our school, our research and the wider university as well. And we also have a community-driven programme of activity and exhibitions, and we work in a community development principles. So basically an individual or an organisation or a researcher can come to us and say, this is what I want to do, and then we try and think, how can we support you to do that? So it's not necessarily us coming up with things, this is what we're going to do. That's the kind of model we work to. There's quite a lot of text on this slide. I'm not going to go through it, but I thought it was just interesting to plot the development of the hub alongside the National Coordinating Centre for Public Engagement's EDGE framework. There's 4 stages in the EDGE framework. It's supposed to be a self-analysis that organisations can do, but I do feel like it reflects quite well the hub. So 21 to 22, which is the year my post was created, the year before the building opened, there was a community engagement, public engagement group led by Sarah, and we had started some consultation and then moved into co-production later in that year. So that's kind of embryonic stage of the hub. And then 22, 23, the class pairs was open. So of course the hub was open too. And what we were doing then was operationalising the 6 impact goals that had been developed through that first stage through the theory of change and the co-production. We had a very small core budget, but we managed to we put some money wherever we could get, like from MVLS Engagement Fund or from Glasgow Knowledge Exchange. And then we moved from the Knowledge Exchange work stream to a community engagement with research group. And so that stage would be steps towards a structured support. Then the next year, 23, 24, there was really that saw a massive growth in the hub in terms of numbers, in terms of number of staff, students, publics engaged, and an increased budget and a increased, so previously it was just myself, and then we had a 0.5 administrator who was Ruby, and now we have the amazing Lorraine that supports the hub both in terms of all the room bookings, admin, but much more than that. She brings the values, the culture, she helps with a lot of our equality and diversity work in the hub as well. And then last year, I would say it was getting to a stage of embedding, so enhanced communications, the addition of what became Callum's role, the events coordinator, and more so than just writing into research grants, actually our first university drawing down funds to the hub. And really working in a way where the skill set remains in community and it's not just researchers going and working in community and then leaving. So university is a whole other presentation that the team could do. So where are we now then? In terms of 25, 26, it's kind of been a year of taking stock, looking at where we've come so far. And that's where I'm going to hand over to Hannah because she's very much helped with that and the research that she's been doing.
So, as mentioned, I've been doing some work with her on evaluation. A bit of context. So, in August 2024, was it Susan?
Yes.
August 2024, Susan had some help doing some preliminary evaluation of the hub and hub usage by Simon Walker and Effie Hassan from the Healthy Working Lives group. They recognised that there was probably a need for more evaluations or more in depth with the stakeholders who use the hub. So I applied for the MRC Impact Accelerator account, the Early Career Research and Mobility Programme, and luckily got some funding to be able to work with Susan a day a week for 6 months to do some evaluation work. So the aim of the evaluation was to assess the wider impact of the Byres Community Hub and understand the people, places, and process that contribute to the efficacy of the services that they provide. So part of the evaluation was non-participant observation. So I think I logged about 29, 30 hours of observation between August and January, and conducted 25 semi-structured interviews with internal and external stakeholders. So that would include researchers, teaching staff, students, professional services staff. External stakeholders would be third sector organisations, community groups, just anybody really who uses the space. And in discussion with Susan, she thought it would be helpful for me to be able to think about this in terms of her kind of hub themes, which are people, place and process. And then just as a small aside, so we also have an experience survey that we co-designed with the Hub Advisory Group, which is live, but I'll not report any results from that now, just the interviews. Oh, right there. Okay, so people, so this refers just to the users of the Hub, staff and students, how people are motivated to use the Hub and engage. So Susan's gonna really hate this. So I'm gonna get this bit over with. So Susan was identified as one of the main pieces of how the hub functions. She really hates it. But she has this skill to be able to navigate both communities and academia in a way that's quite unique for what the hub offers here compared to maybe other universities. She has a wealth of knowledge that she's brought with her, but has also developed well here. So we're really lucky, obviously, to have Susan. But the issue is that Susan's one person. How do we ensure the sustainability of that and retaining the knowledge that Susan has? And suggestions would be maybe to formalise a bit of the knowledge that Susan has, so it's all in her head. So maybe we need to think about systems and processes where we can log and track and monitor connections that Susan is bringing in, but also that other people are as well, so that it's not all the onus is on.
Callum has become quite good at
Yeah. Oh,
that's good.
So another kind of theme that came up is reciprocal relationships. So this is about how the hub has kind of facilitated more of this reciprocal relationships between academia and communities. Although there is some way to go with that, the hub is kind of acting as a bridge for that. So traditionally, researchers would go to community groups and basically ask them for basically all this information and get nothing in return. And Susan and the team here work on the basis of, well, what are the community groups getting out of this? And I think the external stakeholders really appreciate that to as an aspect of the hub that maybe they haven't experienced with other academic settings. Place. So this was the theme that was probably most important to the external stakeholders, so the community groups and third sector organisations. One of them, I think most people have probably heard about Susan talking about the cafe. So the Absinthe Cafe is what we've called it. So the cafe was kind of recognised by both internal and external stakeholders as a really important part of social infrastructure of the university and the Byres Community Hub, and that the loss of it has been felt quite deeply by internally and externally. In terms of internally for Susan, I think, and the team, it has meant that people have lost that soft landing for the university and the idea of the third spaces and welcoming spaces. So the soft landing in terms of people had a reason to come in to the university, even if they previously didn't think they did have a reason to be there. I think the loss of the catering staff. So we had Lorraine, who used to work here. She was kind of an informal host to the space, and she would even signpost to different services to people who were there. And I think a lot of that has now fallen back on the Byres Hub team to host the space. Reception, yeah. So I think that's been a bit of a miss there. I think a good example of the cafe was one participant who, I think it was this participant actually, who found the cafe in the Byres Hub when at a really hard time in their lives, and used to come in multiple times a week to use the space and to just chat to people when they were maybe feeling lonely, or to speak to Lorraine, and then eventually that person joined multiple groups that the hub hosts. So that person might not have previously been able to use university as a space to meet with people, but now did. But a lot of that was kind of felt. The next one, extended open hours, I think it's really obvious. So this person said communities don't finish at 5 o'clock. So the opening hours of the hub just now are 8 till 5, Monday to Friday. And that kind of misses a key group for university. They have a space for people who are of working age or younger people and families. I think that's kind of what Susan says is we're kind of missing from the hub at the moment. And extending those hours would encourage people to use the space where they would alternatively find other spaces they'd probably have to pay for. So by extending those hours, it could really draw in these groups. And process. So this is the task involved in the development and delivery of the hub. So operational delivery with minimal resource. So I think it kind of says that Susan and the team do a large, they provide so many services, but on such a small kind of resource and budget. And what is the sustainability of that in the long term? So Susan and the team are responsible for kind of fostering these genuine engagements and connecting people, as well as finding their own funding and making hundreds of cups of tea. And even, you know, Susan says that she could get 100 emails a day, but when does she have time to respond to all those? So it's a real area of concern about what the future would look like for the hub if they were to kind of develop and further, given that the capacity of the team is it struggles. So and then this final one is shifting research culture. So speaking to lots of researchers, it's felt that since being in this building, more researchers have engaged with community groups and third sector organisations. So having the hub here has really helped, but there's still a bit of a way to go with that. And I don't think that's a problem with the hub. I think that's a research cultural thing. So lots of people talking about how they feel like engagement isn't really appreciated in their workload. So there's a bit of a disincentive to kind of foster these genuine relationships and do public engagement, you know, things like that. And so how do we think about embedding and changing the culture of research, of engagement and research? So that was just a quick whistle stop tour. So there will be a report that I've have that will be hopefully circulated to anybody who'd be interested. There's also the experience survey if anybody wants to complete it or share the link. And I wanted to leave Susan with something for the hub for year on year, so it wouldn't be just the kind of 6 months time I have with her, but so year on year she could use this or develop it in any way she wants. And hopefully it helps the ongoing work. And in fact, thank you.
It's just been amazing having the research, because some of it anecdotally you kind of know, but just getting that evidence behind it, and some of it, you know, that I've seen as the report too, is surprises to new things. And so what the research will do will really help us inform the strategy going forward. And then what the Clarence Pears Community Fund will do is help us to be able to do that. So the fund is something that also was the result of this current academic year, and a long process with the support of external relations. And so we're really thrilled to have been awarded an investment of £100,000 a year for at least the next 3 years. We can demonstrate impact. It's maybe potential for it to be longer. So the Pears Foundation were obviously involved in the building, the actual possibility of the building, but this ongoing relationship that we have with them, and they've never funded anything this way, and I've never heard of a fund like this. So it's a flexible fund where you can respond to community-led opportunities, but also does have priorities, which I will go through. So that is, I suppose, a kind of marked change in the hub and what we're able to do going forward and in answering some of the things within the evaluation. So the priorities are enhancing the welcome and accessibility of the hub, looking at that issue of opening hours. But I would say it's not just about people coming into here out with 9 to 5, it's about us going to where people are when they are. And most of the requests we get from community is to go to gala days, to go to health and wellbeing events, to go to things, and they're often at the weekend, they're often in the evenings. We do as much as we can as a team, but certain times of the year that means working quite a lot of weekends. So there's an issue there, and that's if we are a bit like helping to track the impact from the wider school, that's where we would really welcome, because it's just such an amazing way to get out to community, to make links. There's open doors there once you've been out and really supported their events on their terms, and when it comes to your research. Supporting meaningful inclusive gatherings rooted in hospitality, there's a cafe thing again, and shared purpose. Refreshing exhibitions, that's probably one of the main costs for our core budget, is the actual print for the exhibitions. So having community fund really helps, and it helps you as researchers as well, because it means we can work together on exhibitions in the temporary space out there. This has probably been the best thing about the fund so far. These are the things that day to day don't cost that much money, but just make a huge difference. So being able to go to Tea House more regularly and collect the money and put it in all the envelopes for the travel expenses, and these kind of things are just so important, and so that's been brilliant. And there's just a wee quote there from Amy, who's the director of the Byres Foundation, just demonstrating that the fund is the continued belief in the mission, and the potential of the hub. So thank you to everyone that's joining online and in the room today who's been part of the hub journey so far and has helped secure this money, and especially to the community groups, many of whom have met in person with the Byres Foundation when they've visited, and that's really stood out. So I thought that it would be useful today. I could do a whole presentation just on this slide, so I won't be able to go through all of this in detail, but I thought it'd be useful if you're sitting thinking, well, that's fine, but how can I embed the hub in my research? Oops. How can I was doing this earlier as well when we tried it. I don't know why it just keeps jumping. Yes, I did current slide, but went back to this time. I think it might do it again. I set animation on this to come up in the numbers 1 to 10, and it's not doing that, and it's just jumping to the next slide, so apologies. I also did a presentation to the school management group towards the end of last year, and it was really looking at this, how to have more clarity with researchers on ways they can get involved in the hub. This ranges from just helping raise awareness amongst your own network, and then networks your research partner knowing they can come in and use space, that's all good, through to actually contributing to the skill sharing and the research. I mean, Michal's presentation there just blew me away, that level of data analysis, data linkage, that skill set, like that is something that we just don't have in community, and taking a part of that and helping an organisation look at a comparative, look at the data they have, look at it's just amazing to be able to have that skill set here and how we can share that more. We also have loads more research opportunities, I feel, even in the hub. So this analysis that Hannah did, I feel like there's so more there that we could look into. And there's research questions come up all the time. The digital breakfast, that's brought a research question up around tackling the digital divide and the impact on mental health. And through to the kind of comms piece as well. So we do have a blog that, since we've been putting more news and stories out in the newsletter, we've not been updating the blog as regularly. We used to do it 10 times a year. But I feel it's a missed opportunity because it is a good communication channel for external audiences. So it would be great. We've already had some researchers contribute to the blog. It'd be great to do more of that to kind of showcase some of the engaged research, the work that you're all doing in the school. So it takes it wider than just stories about the hub, but actually stories about the school and our research staff, but written for a lay audience. So I'd really welcome any input to that, or as I mentioned earlier, the temporary exhibition space out there. So the best way to find us is the engagement exchanges every Monday from 2 till 4 in room 165. Come and talk to us, talk through any of these ideas, or email Byres Hub and myself, and we can arrange a different time to meet. Go back to me now. I just wanted to finish with a mention of our community day. So this is the school's annual community day. So it's the biggest event of the year in the calendar. It used to be in June. We've moved it to March now. And so it's the end of this month on Saturday 28th. We've got quite a few research groups that are going to be delivering activities on the day as part of the Byres Hub subway. And there's 15 different stations. So it's either community groups, community partners, research partners, or research groups. And we've got a call out this week for volunteers to help as general volunteers on the day. So if you can spare a couple of hours on that Saturday, then please get in touch with us. And we've got a briefing on the 10th of March where we can kind of go through the plan and the layout and things. And if you can't volunteer because of commitments and things, but you are able to drop in, then please do come along, bring the kids and all that kind of thing. And just the final stage there is just about staying up to date with Hub. So we have lots of communication channels, and you can tag us on Instagram as well if you use it, and we can share the work that you're doing. We also have some videos, but there might be other videos within the school or that are related that we could add to this playlist. It's just another way of people finding you as a way in through the community work, through to your research. Yeah, I'll leave that slide up there, and that's me and Callum and Lydia in the photo. There was another photo that had the whole advisory group. Yeah. So I thought I was going to embarrass some people in the room by having a photo up there, but it's not there, I'm afraid. So I'll stop at that point just to allow time for some questions.
Thank you very much. Excellent, thanks both. Yeah, great to hear both sides of it. I think so. Any questions in the room at all? Yeah, David.
That's the obvious one. I mean, well done, that was great. But in terms of the cafe, especially that you've got an evaluation that you use to do the case.
I keep saying the cafe will return. Yeah, the cafe is coming back in some form.
Yeah, in some form.
We just don't know what that's going to be yet, but it's back with senior leaders in the university.
They won't let us have a cafe if we can't make a profit. We can't make a profit because we need to make £40,000 a year.
But we do now have the community fund that is part of the priority is to bring back catering of some sort into the space. That was part of the funding. And we have the evaluation data as well. So it's a really compelling case to try and come up with a solution. And, you know, other universities contact us to ask about the work we're doing in the hub, both Scotland, UK and wider. And so it's another opportunity to do something really different and unique with that hospitality offering, that catering offering, that other people could kind of see how that might work. So I really hope that we can come up with a creative solution, but it is coming back. I'm just going to keep saying it because it is going to happen.
I'm like total about it.
It is coming back. We are getting a cabinet.
And some positivity.
I mean, we have to argue this with the commercial element of the university rather than all the research people in the university say this isn't a vanity project. Of course, this is important for the kind of research that we do. Can't make the money. I'll stop here.
One question. I'm really interested about what you're saying about like people and kind of making sure that like it's reciprocal. I just have a question. I don't know how it's phrased, but like, is there a sense of like what would be useful to kind of give back? We had a group that we had given vouchers, or we wanted to do vouchers, but then it affected their universal credit, and that seemed to be like kind of because we're doing a lot of poverty research, so like it came up a lot, and it was difficult to find like an in-kind thing that was relevant? Like, yeah, I don't know if you have any kind of.
So it is about giving people the choice. So it's still always able to offer that option.
Okay,
There's a community group that are coming in to take part in some functional fitness MOTs and a visit to the hub that Katrina Bannigan, I think, is online, is going to be doing in March. You know, I knew their cheer yoga was at risk of not running because they've lost funding. So they're going to bring a minibus of people here. They're going to have a great day. They're going to get to take part in functional fitness, and in return, can we do the Sunday form with them? That's really that buyout for the staff to come for the day, to be able to come, but that's what they'll use that for.
okay.
So that's helping the group, it's helping out, like everyone sort of wins out of that. So it's finding out what that individual or what that group, what was useful.
Yeah.
And I mean, I don't think we can overstate how much community groups value the skills that we have that we don't actually share with them. Some of us do, and we do, you know, but not many of us do. And when we were kind of designing the idea of the hub before we ever like commissioned any kind of evaluation of what we were going to have in here, my biggest fear was no one will come. Like, we're going to set this up and no one will come. Now we have like how many organisations? But we've got 7 researchers from the whole school out of 293 people that we said yesterday on the head of school slides, plus all the students. We've got 7 people volunteering for our community day, and this is our 3rd one. So you think fourth, actually fourth, is it probably getting worse rather than better? Now I realise that everyone's completely overstretched, but the reality is that our research needs to have partnerships with people outside because funders are, you know, there's kind of funding effect. Can you demonstrate this? Can you demonstrate that? You should be demonstrating that meaningfully rather. And so if we can therefore like properly say, like involve several groups that do stuff for, like help with the funding application or write a support letter, or these are in kind things, but also as Susan says, we might get the whole organisation that bus trips or deployments rather than give individual lectures. Or I think there's lots of ways that we can help. I do think as a school, particularly in this kind of challenging funding climate, if we don't, a bit like the building, but if we don't use the hub, we may well struggle.
Is there any questions from anyone online?
Yeah, I was just gonna say, is there anyone online that has any? Feel free to shout out.
Tell me your presentation that you
So since the hub opened, most of the time in communities I'm just at networking, listening and learning and trying to make links. So limited to what we can actually go and deliver in community because we're doing community engagement every day here in the hub. But in terms of outreach stuff, what we're always asked for is during the summer. It's all like the gala days, the FET days, having a health and wellbeing stand. If they're having a health and wellbeing event, there's one just now, calls come in to ask for us. And so it's just going along with some activities, some information, trying to have a bit like the community day, trying to have a sort of fun, engaging things that will hook people in to then be able to talk more about the work that we're doing. We also have used the BSL work that Lorraine does, and that's been received quite well in the community as well, you know, teaching people about BSL as a way to engage. And we have art activities and things like that at the stand, like Cal's been out at Partick and decorating the tote bags and things, but just engaging with people and then having the flyers and having the information there. There's been a whole range of different research that's been out as well.
and if you require from them, just to turn up. I don't ask them for anything other than that. You know, I mean, as a school, how many people in this room have written something about health literacy? Yeah, there's opportunities for us to go out and engage with people to start conversations about more appropriate than they currently use. And nobody really takes it. I know it's not everybody's bag, but you think out of, you know, so many of us, some of us do think.
Great call to action to end on. Thanks, everyone. We're out of time there, but yeah, thank you so much to all the speakers today, and yeah, we'll see you, I think, the end of this month before Easter for our last one. Cheers. Bye.
There's loads of these flyers out about.
Well, yeah, but you must have something that isn't optimistic to put in here.
Yeah, I generally.
Well, I was gonna reach out to Sandy because well, maybe I'll wait until I see if I get money and then